Welcome back. This afternoon, you're listening to the Todd Laborowitz Show, Real Estate Radio on Salem Broadcast Network, WRC 1260 AM. I'm your host, Todd Laborowitz, and we're speaking with Jim Guynn, Vice President and owner of Distinctive Home and Healthcare, Inc. They provide personal care for seniors and the disabled within the comfort of one's home. Also, Distinctive Healthcare provides healthcare and professional staffing solutions for the federal government and military hospitals. Well, Jim, welcome to the studio. I'd like to start out by talking about finding help within one's home, because there's illnesses that are out there. People don't want to go into a retirement home, and they have long-term care. They have all these benefits to have in-home care. Can you explain that a little bit further of how someone gets started with you?
Yes. If anybody has a relative, a loved one who is a senior or handicapped, they simply can call us. It's usually a 15-minute conversation before we engage. We explain to them our services, our credentials, the process, and we provide certified nursing assistance in the comfort of their home. As you indicated, most people want to stay in the home and age in place or recuperate within the home versus going outside the comfort and confines of their own home.
And it's usually paid through long-term care, or?
It's typically private pay, but we do accept long-term health care insurance.
Okay. And the people that are going into the house, because I have some experience with it with personal relatives, how do you screen and hire the caregivers that you're giving?
It's one of the things that I believe distinguishes us from some of the other competitors that are out there. Being a government contractor, we have to subscribe and abide by certain regulations and standards in terms of all the background checks that we do. So we run national criminal checks on anybody that goes in somebody's home. We go back 10 years, and we go back everywhere they've ever lived or worked. We also do credential checks, and we have companies that we engage that do that to ensure that their licenses are up to date, their certifications are up to date, and we do old-fashioned reference checks as well. We make sure that all three of those areas are done completely before they go into anybody's home.
Okay. Because when someone goes in, I mean, this is their home, and it's no longer their home anymore. The person that's not being taken care of.
That's exactly right. We provide services as little as 4 hours per day up to 24 hours per day. And one of the things, it's not just about the credentials, but it's also got to be a personality fit. And we make sure that we do a lot of back and forth and a lot of discussions with the family members to make sure that the personality of the caregiver matches the personality requirements of the person being cared for. Perfect.
And those caregivers also help with taking people to their appointments?
Yes. We provide personal care, which you indicated earlier, which is all about the activities of daily living, all of the help that's required in bathing and feeding, transferring, all of those things within the home. But we also do what's called the companion care piece, and all of the going to pick up prescriptions, taking them, shopping, helping in any way that we can, both within the home and also running errands outside the home.
Perfect. Now, how is it different when they say assisted living environment versus a nursing home environment?
Assisted living is what it says, really. Assisted living. They have assistance. A nursing home is where a person needs total care, and they do not get or have aged or digressed beyond assisted living requirements.
But they both are required outside of the home.
That's correct. Assisted living typically takes place after the home care can no longer be utilized. The disease is either worsened or the illness has progressed to such a degree that more care is required. Home health care is usually the first stage of the process when additional needs are required for the person.
Okay, because I've always heard that through family members, like, I'm not going to a nursing home.
Assisted living usually precedes a nursing home environment.
Got it. It usually
care.
happens through age or an illness that's getting a lot
that's
worse.
Right.
So where are you guys located, and where do you provide your services?
We're privately owned, so unlike a franchise, we can service the entire state of Maryland. We're not limited by any zip code restrictions or anything like that. So we service, and we're licensed, bonded, insured in the state of Maryland and also in Washington, D.C.
Okay. And what makes Distinctive Home Care different than other home healthcare companies? Because there's a lot that are out there.
There are.
And a lot of the spouses that are not being taken care of get a little frustrated because you said about the personalities matching. It doesn't always match. It might match the person being taken care of, but not the spouse.
That's exactly right. And we try to do a very strong vetting process and screening process to ensure that the personality is just as important, really, as the credentials of the care provider and the experience of the care provider.
Do you provide the training as well for the care providers so they know how to handle a situation?
Yes, we absolutely do. And all of our care providers have at least 2 years' experience. They all have to be certified nursing assistants, which is a state certification and license that they have to have. But to answer and circle back to your question, I touched on this briefly before. What makes us different is we are privately owned. We're not a franchise. So we can cover the entire state. If somebody is calling us in Waldorf, we can service them in Waldorf, even though we're based in Largo, for instance. And that also provides our ability to be able to give some very competitive pricing because we're not kicking up a percentage to a franchise entity. In addition to that, we all of our caregivers are employees. They're not independent contractors.
Which makes it more controllable.
Much more controllable, less turnover, and all of those things that are associated with that.
Oh, great. Well, by the way, if you're just tuning in, I have with me Jim Guynn from Distinctive Home Care. I am your host, Todd Laborowitz, and you're listening to Salem Broadcast Network, WRC 1260 AM. Well, Jim, how did you get into this field?
My wife actually started the business. And we got into it originally having seen the care requirements for grandparents, having seen some of the unbelievable caregivers that are out there that provide just an unreal level of service to seniors, to the handicapped. We felt like with the aging demographic that was out there and seeing these experiences, we really wanted to get in where we can not only help people, but also get into a business that is certainly growing in this area and others.
Okay, so you got a lot of baby boomers in the area, plus you're dealing with the federal government and also on a personal level.
That's correct. A lot of the typical caller, if there is such a thing, because there really is a vast array of types of situations when people do call, is the son or daughter or grandson or granddaughter of seniors that need help. And they call our company to see what sort of services that we can provide. And it runs the gamut from simple companionship service where somebody just needs help having their meals prepared and running errands at the grocery store to them, to a 24-hour situation where we're handling all of the needs of a quadriplegic. So wow. It runs the gamut.
So you said your wife started Distinctive Home Care.
That's right.
And Healthcare Inc.
That's correct.
And her background in this business is?
Healthcare administration.
Okay.
That was her background from an education standpoint, and she's worked in the healthcare field for 10 years before starting this business.
Okay, so she saw a need and also had the passion, because this is not an easy field to be in.
It is not an easy field. It's certainly service and care driven, and she has that. And she began the business very small, and we've been out of Largo the last 11 years, and have been in business since 1997. Perfect.
And with you getting involved with the business, what's your background in connecting to this?
My background has always been staffing services. That's I worked at a very large organization, a national company, and we provided staffing at a variety of levels. And it was a natural fit for me when she called upon me to join to help out in that side, the business side of the healthcare and home care business.
Because your side of the business, I mean, her side I understand, but doing the background checks is the most important part of this business that sets you aside from everybody else, because it's a tough situation to be in, especially for a company.
It is, and quite frankly, it's probably the most significant question, and it's a question that we have to dwell on when somebody calls us and asks us, how do you check these people out before they come into our home? It's a very important part of it.
Do they get to see the reports, or is that just confidential?
They don't see the reports, but we go through them with the individual, and we go through them in detail, and we allow families to come and interview the caregivers, whether it's in their home or at our office. We welcome that, and we can give them 2 or 3 options to choose from. And if they ever want to make a change, or if there's ever a personality issue that comes into play, we can make that change within a day's time.
Perfect. And all these people are on the federal side, where I'm sure you have intensive background checks.
Very intensive background checks, but we do the same thing on the commercial side. Perfect.
Well, what I'd like to do is offer you, our listeners, a chance to get in touch with Jim Guynn with Distinctive Home or Health Care. All I need you to do is become a fan of the show at toddlaborwitt.com. That's TODDLABOR, like a woman going in labor, WIT.com. And you'll have access to all the information so you can reach Jim Guynn at Distinctive Home Care. Well, coming up after these messages, we have Justin Saltzman with Liberty Mutual, and then we'll have Mortgage Matters with yours truly, and we'll be talking about out-of-town lenders and appraisals coming in low.
Investors endured 2 devastating bear market corrections since the year 2000. Unfortunately, many people still haven't recovered from their losses, yet our clients tell a different story. I'm Jim Musgrave with Research Financial Strategies. For investments that make money in both bull and bear markets, call me at 301-588-0514 or visit jimmusgrave.com to learn how Research Financial Strategies can benefit you, your family, and your business. Can you afford not to?